My name is Ivan Batista. I'm a student at Walden University in the Family Nurse Practicing program. This is my head to toe assessment. First, I will pretend to wash my hands and come in to meet the patient for the first time. So, hi, my name is Ivan Batista. I'm the nurse practitioner taking care of you today. How are you?
Hi, good, Kelsey.
Nice to meet you, Kelsey. First, we're going to do a full head to toe assessment on you, okay? So, we're going to have you kind of sit and stand here and there and lay down and so forth. So, first, what I'm going to do is assess your skin. So, anything that's exposed. What I will be doing is checking to see what your skin color is and the turgor, making sure that you're not super diaphoretic, to see if you have any skin folds, any lesions, if you're intact, if you're sweaty or not. Looking at your feet as well to see if there's any abnormal, anything abnormal in her feet, if they're swelling, if there's any abnormal moles. Here at this point as well, you can actually see if she has edema, which she doesn't. So, moving forward, since her skin is intact, we're going to assess her head. So, moving on with her head, we can also take a look at her hair. Her hair, it's clean, it smells good, she's hygienic, she's odor-free. So when we palpate, we're feeling for symmetrical shapes. We're looking for any sort of lesions and or masses. Also, while you palpate, see if the patient is grimacing for pain or anything, which she is not. At this point as well, we can also feel the sinus cavities. We can palpate the sinus cavities to see if they are painful or not. Is this hurt, ma'am?
No.
Okay. Perfect. Very good. And we'll move on and assess her neck as well. With her neck, we're looking to see what her head is doing, and is it tilting? Is it shifting? Is it not? In her case, it's central. So we're feeling for any masses, weaknesses, to see if she's tilting on one side or favoring one side. We can also feel for some nodes. We can do the cervical nodes in the back here, the preauricular nodes, the postauricular nodes, preauricular nodes. We can do the tonsillar nodes, the submandibular nodes, as well as the subclavicular nodes, which seems to be fine. Okay. With the process of assessing for her neck as well, we're also looking for the spinous process to make sure that this is intact and making sure that it's all in line and so forth. Also, while we're doing her neck, we can assess her trachea and her thyroid. One thing that we can do besides palpate, we can also do the swallow test, which we have some water here. We'll do here in just a second. So, what we're doing for especially for the thyroid, we're feeling for any masses, any enlargements, which she doesn't have. We can also kind of adjust on the trachea here. It is in place, it's central. So what we're going to do is we're going to use the swallow test to test to see what her thyroid is like. So go ahead and take a drink, ma'am. And I'm going to just go ahead and swallow. Okay, very good. And it's all central. No abnormalities there, so we will move on. Also, with her neck, we can check to see the range of motion and see if there's any pain, which she doesn't have. So, since her head and neck seem to be okay, we're going to move on and check her eyes. With her eyes, prior to coming here, she got visual acuity, which was to check to see the cranial nerves too. But for the purpose of demonstration, we're going to pretend this is the Snelling test. So I'm just going to have her cover one eye, and I would have her read the closest, or at the close range, I would have her read the smallest number or letter that she could read. And then I would come back, and I would have her read the smallest letter, and she would read that to check for her visual acuity, both from the near and far, which is checking to see what her cranial nerve 2 is. So, also with the visual acuities, besides the visual acuities, checking her eyes, we want to also take a look at her peripheral vision. So, let's see here. with her peripheral vision, I just, ma'am, if you can just tell me when this is coming into vision. Okay, perfect. So she's got some good peripheral vision. What we're going to do is also we're going to palpate to see if there's any abnormalities in her eyes. We're going to check to see her glands to make sure that they are, and check for conjunctiva to see if they're nice and pink. We can also do another sinus test here and check for that. You can actually percuss here to see if she's hurting there, but she's not. So what we're going to do is we're going to measure to see what her extra ocular muscle movements are. The way we're going to do this is going to test to see her cranial nerves 3, 4, and 6. So ma'am, what I'm going to have you do is just this light. I want you to follow right and left, your left and right, up and down. So if you could just follow me. It looks like these cranial nerves are intact. She's following and not tracking, so we want to see if both eyes are tracking at the same rate, if one is favored or not. So they're not, and at this point her eyes look fine. So what we're going to then do is do the ophthalmic eye exam. What we're going to be looking for in her eyes, we're going to be checking to see the vasculature of the retina, to see how it connects with her discs and so forth, to make sure that they're nice and clear, and to look for any microaneurysms, any hemorrhaging, and or masses or any abnormal growth. So what I'm going to have you do, ma'am, is if you could just take a look in front of me. I'm going to come in really close. I'm going to try not to blind you. Okay, very good. And the vasculature looks good. She has no hemorrhages in that eye. We're going to take a look on this side as well. Okay, very good. And so with her eye exam, it seems pretty normal. She doesn't have any abnormalities in her vasculature, no hemorrhaging, and so forth. So moving forward, we're actually going to take a look at her ears, her nose, her mouth, and her throat. So using the otoscope, we're actually going to check to see. Here, just 1 second. Okay, so in her hearing test, or her ears, we're going to inspect the outside of her ears. So primarily we're going to check to see if there's any abnormalities, which there's not. We're going to check to see the external canals. One thing that we're going to do is we're going to check her cranial nerve 8, which is the acoustics. So what I'm going to have her do is just cover one ear, go ahead and plug one ear, and I'm going to whisper, and this is the whisper test. And she's going to say it back to me. And so her cranial nerve 8 seems to be intact. So what we're going to do is we're actually going to take a look into her ear. What we do with adults is you pull up and away and then inspect that way. So up and away. Very good. And this side will be a little bit easier to see. So we'll pull up and away. And then look in. And what we're looking for in her ears, we're looking to see what her tympanic membrane looks like, to see if they are intact and make sure that there's no fluid or redness and so forth. In her case, they're nice and pearly gray, so they look just fine. Since her ears look fine, there's no. We'll move on to her nose. With her nose, we want to check to see if there's any septal deviations. We want to see if there's any foreign bodies inside. So you never want to stick this up too far because that can cause some pain. But in doing this, you want to check to see the vasculature, to see what her mucosal layer looks like, if it's nice and pink and so forth, which it is. So moving on, there are no deviations, there's no abnormalities, so we'll move on to her mouth. With her mouth, we are going to check to see for dentation. We're going to look to see for dental caries. And also, we're going to check the back of her throat. This is a good time to also check some cranial nerves by having her use her tongue. By sticking it out, we're checking the cranial nerves 7 and 5. And go ahead and stick out your tongue for me. And then go side to side. Okay, give me a smile and a frown. Okay, and if you could, push on my fingers with your tongue through your cheek. Okay, and this is also testing cranial nerve 9, I believe. So they're all intact here. So let's go ahead and give me, open your mouth for me. Say ah. Okay, and what we're looking for is the buccal mucosa to see if it's nice and pink, if it's dry, or if it's, hers are nice and moist and so forth. We can also check, I won't actually do it, but we can also check her cranial nerve 10 for the vagus nerve and cranial nerve 9 as well, which we can check to see what her gag reflex is and so forth. I'm just going to semi-demonstrate this. I'm not going to actually gag her, but go ahead and say ah for me. And so we pull this back to see what her uvula looks like, and if they gag, that means that their nerve is intact and so forth. So that is, her mouth looks fine, gums and stuff look fine. So moving on, we're going to look at her lungs and chest. With her lungs and chest, we are going to listen, or going to inspect to see if the rise and fall is symmetrical, to see if she's labored breathing, if there's any retractions. So first, with her lungs and chest, we're going to inspect the anterior portion. So since she's breathing normally, everything's symmetrical, we're going to take a listen. When we take a listen we're listening for any adventitious lung sounds, and we're actually going to use the diaphragm. So we want to go from one side to the other to make sure that we're contrasting. So. And our lung sounds are clear. With women and or people that are somewhat overweight, the lower lobes can oftentimes be difficult because they are diminished, or sometimes it just sounds like they're diminished even though they may not be. So next thing we can do, we're going to check to see what the tactile fremitus is, and that just it's the vibrations. We can test to see if there's emphysema or pleural effusions or so forth. So you just take the outside of your hand and you just ask the patient to repeat 99.
99.
Okay, and there's vibrations throughout her field, so there's really no risk of any pleural effusions and so forth. So what we're going to do now is we're actually going to have her. I'm going to have you kind of stand up for me, man, and we're going to have you stand. We're going to check to see her back as well. So we're going to listen to her back and look for symmetrical rise and fall again. But again, we're going to listen. And again, from one side to the other. And all her lung sounds are clear, and we can do the tactile fremitus again, so go ahead.
99.
Very good, very good, very good. Okay, you can sit down, man. So with her chest, her lung sound fine. Her lungs are not, they're no adventitious lung sounds. So we can move on. At this point, with her chest exam, we could actually do the breast exam. We won't demonstrate this for the purpose of this demonstration anyway. But we will do some of the axillary nodules. So we'll test to see if there's any abnormalities here, which there isn't. But with the breast exam, we would palpate the breast to see if there's any masses, abnormal growths, if there's any discharge, if there's flaking, or any kind of infection in that case. So in her case, she doesn't have that. So moving on, we're going to look at her cardiovascular system. In the cardiovascular system, we want to see what her skin looks like. Obviously, bed circulation can kind of tell you what that looks like. So first, we check to see what her veins, her neck veins look like. That could give you a good idea of what if she's having any cardiac problems, especially right-sided, which she's not. So we're looking for symmetry, and also we're going to palpate. So the palpate, the point of maximal impulse, the PMI, which is right here. This is where the mitral valve is. With women that have bras and or heavier people, typically skinny men, you can feel that point of maximal impulse very easily. But it's right about here. You also want to palpate the apex, the left sternal border, and then the base. Along with this, so the point of maximal impulse is usually mid-clavicular line at the fifth intercostal space, so it's usually right about here. So we will listen to her heart, anyways. So you want to, what you're listening for when you listen to her heart, you want to listen for the S1 and S2. Most of the time, S3 and S4 are not heard, which is not abnormal. But you also want to hear for any snaps, clicks, some murmurs, and or rubs, any sternal rubs or anything like that. I'm sorry, cardiac rubs, not sternal rubs. So which she does not have. So her lung sounds, her heart sounds are okay. They sound, there's no murmurs, and they are systolic. So what you can also do is have her sit down and lay down. Go ahead, ma'am. Just lay down for me real quick. We'll get this just for a second. So when you lay down, you can also take a listen. Sometimes this changes the way that you can hear the heart. The reason why that is having the patient lay down, oftentimes the fluid can actually rush up, and you'll be able to see distended neck veins and so forth. But in her case, she does not have it. Okay, you can go ahead and have a seat. Sorry to keep you up and down here. Moving on, since her cardiovascular and her chest look fine, the cardiovascular system looks okay, we're going to look at the peripheral vasculature here. So again, we can look at her neck veins, and we can feel for pulses. First, with her pulses, we want to see if there's, if she's visibly edematous. We did it earlier in the exam, but she doesn't have any edema. So when we feel for her pulses, especially her carotids on her neck, we want to make sure that we only do one at a time. Here, let's bring it up. So one at a time, just because you don't want to close off both. She could get dizzy. The patient could get dizzy. So they're nice and strong. +2 bounding pulses. And then behind her knees. And then behind her ankles. And then the dorsalis pedis as well. So they are all strong and present, +2. So along with her peripherals, we would auscultate, actually with the bell, over the carotids. And what we're listening for is the brewery. So you would also do that for over the renal arteries. You could do that over the abdominal arteries, especially at the abdominal aorta here, which if there's breweries, or we can do that at the abdominal section. So since her peripherals look okay, they're intact and bounding, we will move forward with abdominal assessment. So you can go ahead and just lay down for me, ma'am. With the abdominal inspection, first we want to see if there's any sort of distension, and in her case there's not. So with the abdominal distension, especially laying down, a lot of times the fluid can come up and make people very short of breath and so forth. So what we'll do is inspect first, see if there's any distension, which there's not. Second thing you'd want to do is you want to auscultate before you actually palpate. So we want to check all 4 quadrants. And what you want to hear for is any abdominal sounds, so any gurgles, any snaps, and so forth. That all is pretty normal. With her stomach being, since it's not distended and she's got normal bowel sounds, we will actually start with light palpation on all 4 quadrants. See if there's any tenderness, which there is not. and then you can go back and actually do a deeper tendon or a deeper palpation and see for any pain, which there's not. So at that point, you can also do press and do rebound tenderness at the McBurney's point to test to see if she has any suspicions of appendicitis, which she does not. So at this point, we also want to check to see what the liver span test to see the size of her liver. So with her liver being just underneath her rib here, we want to feel for it, and you can also do percussion right at the liver side to see if it gets dull or tympanic. If it's tympanic, it's usually around air fields, and over an organ, it's a little bit more dull. So with her liver span, we can we'll actually measure to see if there's anything. If it goes below a certain part of her rib, if it goes too far, it can show that that's her liver is enlarged. When you feel for the spleen, typically you won't feel for it. You won't actually feel it. If you do, chances are that it's enlarged, and that's an abnormal test. So at this point as well, you can also listen for the aorta in her abdomen or her abdomen to see if she has a possible rupture or whatnot. And if there is a AAA or something to that effect that's super dangerous, you'd actually be able to see it pulsate right here as she's laying down. So, but that's okay. Everything seems to be fine here. So, moving on, since her abdomen's okay, we will actually move on to her neuro assessment. In her neuro assessment, we're actually we can do some abdominal reflexes. So in her abdomen, we can check to see her T3, I believe it is, or T5 to T7. We can actually, if you draw a line towards the umbilicus from the top, and if it contracts, that's a T5, T7. On a diagonal from the umbilicus, it's T7 to T9, I believe. On the lateral in towards it, it's T9 to T11, I believe. And then upwards towards the umbilicus is T11 to T12. So, which those are all intact. She seems to be okay. So I'll actually have her sit down again. Sorry. And before we have you sit, you can stand. Sorry. Before we have you sit down, we're also going to check to see what her gait looks like. So we're going to do a gait test. This is the Romberg exam. I'm just going to have you close your eyes and stick your arms out in front of you. Close your eyes. And what we're looking to see if she's dizzy, if she's going to hold her posture and so forth, which she's clearly holding her posture. You go. Very good. So this is the Romberg test. This is to test for her gait. You can sit down. We're also going to check to see what her motor functions are for her upper extremities. So what I'll have you do is just go ahead and squeeze my hands. Yeah, very good. And then raise your arms. Okay. Lower them. Push out. Push in. Very good. Very good. So she's got normal muscle tone as she's moving her hands and squeezing, which is fine. So at this point too, we could also do sensory stuff. So with this, I have this is like a smelling. This is a lavender. It's just like an essential oil. So to test to see what her cranial nerve 1, which is her olfactory, we just have it. So can you tell me what that smells like? Lavender. So she can obviously smell that. At this point too, as well, we could also do dull and sharp. So we'd go head to toe to see if she can feel that. So is this dull or sharp? You close your eyes for me.
Sharp. Dull. Sharp. Dull.
Okay. So she's obviously, she can feel that the cranial nerve 5 is intact, and so moving on, we'll do some reflexes. First, as she is sitting down, you can do the plantar flexor, which you just take pretty much anything and see if as she flexes, it obviously is intact. Having her leg kind of out, and if you take and you hit the Achilles, if she flexes, that is also positive for her. So we'll keep moving up and use her and do her knee. Okay, those are intact. Moving up, we'll actually continue. We'll do a bicep. The bicep reflex, you just tap on your thumb, and you can see that there's contraction. The brachial here, we're going to see some contraction on our thumb here. And then you also want to do the tricep, which we'll do this one. You can see it better. So on her tricep, you just kind of grab, and then you'll see some contraction right here. What you do. So her reflexes seem to be pretty intact. We did her abdominal. So continuing on, we'll actually have her raise her hands. And if you can raise your hands and touch your nose, close your eyes, touch your nose. Very good, very good, very good. All right, so we'll also have her, we'll just do 2 other exams and have her lay down. On this one, we're going to check to see if there's any meningeal on your stomach, or on your back, I'm sorry. To see if there's any meningeal irritations. So we would actually take her head and bring it, I don't think you can see that. We're going to take her head and bring her chin to her chest. If there is no stiffness or pain, it's a negative test. Also do the Kernig sign where you take her leg. If there's any resistance, which there is not, that is also a possible sign of meningitis. If you could get on your stomach, ma'am. We're also going to do a nerve root test. If there's pain when she moves her leg up, if she has pain in her back, that is not a positive test. It would have to be pain lower here. So go ahead and lift your leg for me. Is there any pain? No. Okay, you can stand up and you can have a seat here. All right, so we've assessed her cranial nerves. We've done a root nerve and the meningeal test. We've done the optic nerve. The acoustics. We've done the olfactory. We've done cranial nerve 3 for eye movements. We've done cranial 5, 3, 4, 7, 9, and 10, and 11, and 12. Actually, we've done them all. So moving on, we will do some musculoskeletal stuff. So with the musculoskeletal, we want to inspect to see obviously what her skin looks like or what her muscles look to see if there is any dystrophy. So look for the contour, the alignment, the skin color. So what we'll first do is have her kind of stand, and we're going to take a look at her spine to see if the curvature is okay and in line, which it is. And in this case, we'll actually, so let's move this just for a second. We'll actually have you bend over at your hips, and this shows what her hips can do to see if they're if she's able to bend. And you can also take a look at her spine just to make sure that the curvature is okay. So there's no deformity, no swelling, and so forth. So go ahead and have a seat again, and we will move on to her shoulders. We want to palpate any bony prominences. Make sure that there's not any pain. And then we'll also do some muscle, a muscle like weakness test. So what I'll have you do, ma'am, is just with pressure, with resistance, just do like a curl, okay? And then with this hand, okay, very good. So they're equal on both sides, and as you can see, she seems to be pretty neurologically intact, cardiovascularly intact, and so forth. So this concludes my head-to-toe assessment. I will, at this point, we would probably gather the rest of her information for her, the rest of, besides her constitutional information, and we would gather all the rest of information to finish off with her exams. So, thank you.